All right. Welcome, everyone. I'm Allison Fiscalini. I'm the director of the Wisdom Study. We're going to give people just a couple more minutes, but if you've joined and you haven't yet, please introduce yourself in the chat. We always love to hear who people are, where they're coming from, what brought them to the forum. So welcome, and we'll get started in just a couple of minutes. It's nice to see some familiar names and faces. Welcome, and we're looking forward to a great presentation and discussion today. Okay. Well, great. Well, welcome everyone. This is our Wisdom Community Forum. Again, I'm Allison Fiscalini. I'm the director of the Wisdom Study, and am very happy to have our guest speaker today, Sue Friedman, joining us. For those who are just joining, please introduce yourself in the chat. We always love to hear where people are coming from and what brought them to the forum. We hold these forums once a month on the last Monday of every month at 4 o'clock. So please join us in the months ahead. Your registration continues. It's the same link every month, so you can just use the same one. We'll send reminders ahead of time. But now that you have this registration, you've got a registration for the next forums coming up. So welcome, and a few housekeeping items. So format for today's session, we do want to hear from you. We'd love to hear your questions. If something isn't clear or is confusing, feel free to put a question in the chat. We can pause and help to answer that question so that the information is easily understandable. If you're not speaking, if you could please mute yourself. We are recording the meeting so that we post these on our Wisdom YouTube channel as a resource for people who aren't able to join. So if you have people who you think might want to hear this after the fact, feel free to share that link with them when we send it around. And we'll also have a short post-meeting survey at the end. We'd love to hear your feedback. And we'll be asking for ideas for future forum topics as well. So again, we do want to hear from you. Please feel free to put your questions in the chat, and we'll save some time at the end for a live Q&A discussion as well. As I mentioned, we have been doing these every month. We've been doing them close to 4 years now. And so the whole goal here really is to bring together various members of the community, whether you're a patient, an advocate, whether you represent an organization that's in the healthcare field or not. We really want to come together and move toward equity and better outcomes for all women, and really be able to have these conversations around women's health and breast health, and be able to bring this information to the community, but equally as important to be able to hear from the community what topics are important to you, as well as what questions you have, what information we can provide to help clarify some of these topics that can be a little tricky and ever changing. So that is our goal and our mission here. As I mentioned, we've been doing these for a few years. We have a ton of recorded sessions that you are welcome to refer back to. We'll put the link in the chat to the YouTube channel, and there's a whole bunch of information that we have had on these discussions that we are happy to do again. So if there are topics that you'd like to hear about again, they're not off the table. We are happy to revisit them. The science is always changing, and we always like to make sure that we provide the most up-to-date information. So with that, I would love to introduce to you Sue Friedman, who has been a longtime champion and partner of Wisdom. Just a little bio on Sue. So She was a practicing small animal veterinary medicine when she was diagnosed with breast cancer at the age of 33. And after that, learned she carried the BRCA2 mutation. After that, after her treatment, she founded the nonprofit organization that we'll hear more about today called Facing Our Risk of Cancer Empowered, or FORCE. That was back in 1999. And the whole goal was to help people and their families facing hereditary cancer find support, and most importantly, find credible and relevant information and research in plain language so that's accessible to a general audience. In 2023, she was diagnosed with poorly differentiated thyroid cancer, likely caused by the aggressive radiation that she received to treat her initial breast cancer. So, as the executive director of FORCE, Sue has over 25 years of experience directing FORCE's education, research, and advocacy programs. And as an advocate, she has a passion for facilitating informed decision making, improving health communication between patients and their healthcare teams, and increasing health literacy in society as a whole. So huge goals, huge success in her career. Force has been such a resource to us at the Wisdom Study, as well as to the patient community as a whole, and to the clinical community as well. So we're looking forward to hearing more about Force and the different components that they are championing in this field. So with that, I will pass it off to Sue. Sue, I have your slides, or else I'm happy to stop sharing and you can share yours. To you.
Yeah, thank you, first of all, for that great introduction. Really appreciate, love working with the Wisdom Study ever since I first heard about it, I think before it launched. If you don't mind, I think I'll share my slides. I'm not sure, I may have changed them a little bit. I'm always fine tuning. So thank you, though, for that incredible introduction. And, thank you for letting me talk about a topic that I'm really passionate about. And I'm going to go into slideshow mode. And are you seeing any grayed out areas on my screen?
Yes, we are. Yes.
I don't know why that's happening, but I'm going to hide the thumbnail and so if there's any questions in the chat, if you can go ahead and let me know, because I think if I try and look at the chat, it will knock me out of presenter mode. But as Allison mentioned, I've had 25 years of experience as a patient advocate, which means that FORCE is 25 years old. And it's just been such an honor to really serve this community that I'm passionate about and I'm part of. So a little bit about FORCE, and throughout this presentation, I do use QR codes. Feel free to use the QR code to find and bookmark the page, but I'm also happy to make the slides available and provide links to any of the resources as well. But FORCE is a national nonprofit organization. Our focus is the hereditary cancer community. That includes people with Lynch syndrome, inherited mutations in BRCA1, 2, ATM, PALB2, CHEK2, PTEN, and many of the other genes linked to cancer. Some we have more information about, some we have less information about, but it is our goal to really serve the hereditary cancer community. And we do this, we say that we have 4 pillars: peer support, education, research, and advocacy or public policy. And I'm going to go through each of them and the resources that we have. So a little bit about support, starting with a quote from someone from our community who said, "My peer navigator shared her story, emphasized the individual nature of our choices. She shared information, resources, and questions to ask my doctor. FORCE matched us so well, everything resonated with me 100%. We love hearing that. Part of our peer navigation program, our goal is to connect people who are as close as possible. So matching users to a trained volunteer who shares their mutation, their situation, and we train them to provide compassionate support, and then we navigate them to relevant resources. So here are some of the offerings we have through our peer support programs and peer navigation. We have virtual meetings. So as of this year, all our meetings became virtual. So they're available and accessible via Zoom. We have general meetings, but then we also have specific topic related meetings and meetings for people, specific members of our community based on their situation. Our peer navigation program is a one-to-one matching, depending on what the users are looking for. We also have a private Facebook group, which is moderated, message boards that are also moderated, and a helpline. And this is what our support meeting calendar looks like. We also include partner events down at the bottom. So Force works with a lot of partners. There's a lot of work to be done. There's a lot of people that need to be reached and need support. And we know that we can't reach everybody with the work that we're doing. And so we work with partners and we encourage them to upload their information and meetings on our website as well. These are the different groups that we have, but we're constantly adding new groups. We have groups in Spanish, groups in American Sign Language, groups for young previvors, for survivors, and then specific to genes. One of the things that we heard is that, when we did the general meetings, sometimes people with the less common mutations would say, most of the people have BRCA1 and 2, but I have a PALB2 mutation. And so we want to make sure that we're meeting the needs of the entire community to the best of our ability. And then on the education side, so this quote is X-ray. X-ray is one of our programs. I'm going to go over it in a minute, but it gives superior, specific, actionable information. I've used it to plan for bone health. It's helped other members of my family research their own care. So we like hearing that. This is a QR code that will take you to our X-ray program. But just a little bit about the education resources that we have on the Force website. And we've really just recently updated our website to make the information easier to see, to pull in other information from other programs within specific pages. But one of the things that we pride ourselves on is really having gene by gene information based on the most up-to-date information, mostly from the National Comprehensive Cancer Network, also known as NCCN. Once in a while, we'll pull in other guidelines as well, especially if they differ from NCCN. And so for each gene, we have as much information as we can find on cancer risks, risk management options, including the guideline recommended risk management options. Also, any treatment considerations, if there are specific targeted therapies for that gene or clinical trials, we try and pull those in. And then other health considerations, because some of these genes do come with other considerations, including, other medical, medical challenges and medical information that's needed. And this just shows you our risk management page for BRCA1, but we have a similar page for the other genes. And then we have information by cancer. And these are the cancers that we focus on, although, our plan is to add more cancers. We know that some of these inherited mutations don't just increase the risk for these cancers, but also gastric cancer, thyroid cancer. So we're constantly trying to update the information and pull in as much information as we can. And then, a lot of information about things that are important to our community, such as menopause management, fertility preservation, and, overall health and well-being, talking to family members, the things that become really important to people with inherited mutations. So going to talk a little bit about our X-ray program. X-ray stands for Examining the Relevance of Articles for You. So it is an acronym, and a lot of people say, well, I don't understand why X-ray. And the idea was we're X-raying the news, X-raying, looking behind the headlines. And this quote from one of the members of our community: there's so much toxic disinformation in the world of hereditary cancer. Force's X-ray program is the antidote. So this is our X-ray page, homepage. We also have X-ray in Spanish, and we've translated almost all of our X-ray reviews in English, also into Spanish. You can use the QR code to get to our X-ray page, and these are the areas that we focus on. It was initially developed through a cooperative agreement from the Centers for Disease Control and Prevention, but since then we've expanded the program and we get other support. The CDC funding was specific to breast cancer and metastatic breast cancer. But, FORCE doesn't just serve those communities. So we expanded to include all the other cancers and then just a general hereditary cancer risk section. And the reason that we developed the X-ray program, this is a good example. On the left is this very basic science research in mice looking at force feeding large amounts of an amino acid called asparagine to mice to develop a model for breast cancer metastasis. So this was really basic science. There was nothing clinical. There was nothing really actionable that you could do after reading this article to take care of your health. And yet this was media coverage that said, bunk this veggie, stop eating asparagus. And so asparagus, asparagine is an amino acid in asparagus, but it's also in a lot of other foods. And there was really nothing about this research that warranted this headline. So for the X-ray program, we provide a plain language summary of what the science was actually about. And then we give it a score. How relevant is it? And when we talk about relevance, we mean relevance to decision-making right now, because science is cool and we want people to read about science and know about science. But most people come to FORCE because they want to know, what does this mean for me and my decision-making right now, not 10 years from now, but now. So we give it a relevance score, and you can see we gave this one a relevance score of low, because there was really no action to take based on this science. We also give it a strength of science, which is a little different. We talk about, how conclusive was the research? So it got a medium. It was well-designed study. It didn't have a lot of limitations, but it was small and it was basic science. So not really conclusive in the cycle of research. Then we also tell people at a glance where it is in the research timeline so that you can look at the article, look at the relevance scores and see, is this something in clinical trials? Is this something available to me? Because again, that's what people really want to know when they come to FORCE for information about science. And these are just a few of the topics that we covered recently. We try to cover topics that are relevant, that are either guideline changing, for which there's not a lot of information known. So if it's, especially quality of life studies, and things that are specifically relevant to people with inherited mutations. So this was an article about acupressure for cancer symptom relief, which is really important for any of us, going through treatment. A very important study looking at the bacteria H. pylori and the fact that it can increase the risk for stomach cancer in mutation carriers, especially BRCA1, BRCA2, I believe ATM as well. And so that's important information that many people don't know. A study on genes linked to aggressive prostate cancer, articles about breast cancer risk for transgender women, specifically with inherited mutations, because there are some special considerations that, to be at high risk for a cancer that could be affected by hormones, and making decisions about gender affirming care. And there's not a lot of information out there. So those are the types of things that we cover. A study that showed that removing the ovaries and fallopian tubes reduces the risk of death in people with BRCA mutation. So that's an important piece of information that people need to know about. And then a drug combination that was just approved for BRCA, for prostate cancers that have BRCA mutations, either in the tumor or in people with inherited BRCA mutations. So this is just kind of a sampling. I wanted to give you a wide variety of the types of articles that we cover. And then I want to talk about another program that we developed, especially during the pandemic, but it remains relevant today. And this is what we call a digital health literacy program to really help people look behind the headlines themselves. We call it Spot the Boast. And again, here is a link or the QR code that will take you to it. And one of the things that we focus on is helping people look at the source of the information, where did it come from, the content. So what does the information say? And then how to determine, is this relevant for me, for you, for your situation? Again, because that's why people come to Force. They want to know, how relevant is this information to my decision-making process? And it's an interactive website, so I encourage you to visit it and kind of go through. There's some quiz questions. It's meant to be kind of fun, but I'll take you through a couple of the screenshots. So this is a page that has the tips for checking the source of the information, and we kind of go through different types of media sources and say, give examples of them and say how reliable they may or may not be. And I'm not going to take you through, this is just a screenshot, but you feel free to browse it at your own leisure. And this is an example, like government agencies, they tend to be very reliable. Here are some examples. And typically they have a URL extension of .gov. And we have a little more, like a little fold out where you can look at all the different types. So again, meant to be very interactive for people and as user-friendly as possible. And one thing that we focus on too is warning people to be careful about press releases. Why? Because even when they come from reliable sources, sometimes press releases don't get the same scrutiny that peer-reviewed journal articles do. And so even, unfortunately, press releases coming from academic institutions sometimes may get a little bit excited, and the information isn't quite as accurate as what you might find looking at the actual research study, although we all know that research studies are sometimes, full of jargon and hard to understand. When you do a search, adding a trustworthy source name to your search, so, instead of just searching for colorectal cancer, which would have 159 million results, put colorectal cancer and the name of the hospital that you go to or the National Cancer Institute. And, some examples of tips. This was actually an example of an email that I received from a friend who knows what I do for a living. And she sent it to me like, here's some good information for you. And I looked at the information, and the first thing I did was look up the name of the researcher that was mentioned in it, and I went to the website of the organization. It was an Amazing Cancer Clinic. That's a made-up name, but it was a real clinic, and I looked up the name of that researcher, and there was no such person found there. So that's kind of an easy thing to do versus, going to the National Cancer Institute. And again, these are examples from the Spot the Boast website. And again, it has an interactive quiz. So, for each question, you can choose one answer. And then it tells you why one answer may be better than another. And then we talk through what we call the Boast red flags, looking at information and saying, is it biased, overblown, amateur, sales focused, taken out of context, or too soon to be useful, and give people examples of it. This is an example from Sales Focus, that, looking for that sale. Are they trying to sell you a book or, supplements, anything like that? And, for those of us who may be fairly internet savvy, I'm sure most of us know people who aren't. So even if this is a resource that, you don't see as helpful to you, it may be helpful for your friends, relatives, patients. So I encourage you to check it out. So that's kind of the Force education. We do a lot of other education programs, but I kind of wanted to, share the highlights. I want to talk a little bit about what Force does in the research realm. This was a quote from one of our search and enroll tool users that said, I really appreciate having this information readily available. It makes it easier to find relevant studies without having to sort through the whole NIH website. And this is QR code, it takes you to our research programs. Recently, and I'm really excited because I'm going to be presenting some of the results of this needs assessment survey that we just did for people at high risk for breast and gynecologic cancer. We actually have another survey that we're still analyzing data on for people at high risk for colorectal and prostate and pancreatic cancer. But we have some of the results of the needs assessment survey that we did for our community for breast and gynecologic cancer. And I'm going to be presenting it tomorrow in a webinar that I'll be presenting to the AONN. And actually, I don't have a link to that, but you can still sign up. I believe it is free. It's offering continuing ed. And I'm really excited to share some of those results. But I'll give you just one preview. And one of the things that we found across all the different cancer types is about 70% of the forced community and people who responded to our survey are interested in participating in clinical trials. 85% have never been told about studies by their healthcare team. And these are actually were specific to prevention studies, but we've done other needs assessment surveys that have come back with similar results. And 55% of our community don't know how to find a study relevant to their situation. Although the 45% who did, those who filled in the writing comment, many of them said through force. So, that is a point of pride for us. This is our featured research page. So we designed and developed our own database where we can list studies that are of high relevance to people with inherited mutations. And we write them up in plain language. And then we have some search tools around it. But, there's really no other place that takes those studies, enrolling people who have a mutation, may be interested in knowing if they have a mutation, clinical trials about risk and prevention, targeted therapies, and putting them, forward-facing to a community of people who may be really interested in participating. So this is the landing page for our featured research page. And this is a little close up, but I'm going to walk you through some of the facets of the featured research study listing when someone clicks on more information. You can see we list the type of study it is on the landing page. If there is a clinicaltrials.gov identifier number, we link to that. And then we have basic information about the study on the landing page. And then this is an example of the featured study detail page. So when someone clicks on that, you can see we make the study contact or study coordinator contact information front and center. And we encourage people to reach out to the study contact for more information. This, by the way, is BRCA-P. This is a study enrolling people with BRCA1 mutations at high risk for breast cancer, looking at the drug denosumab, which is it's a drug to improve bone density, to see if it can, lower the risk for breast cancer in high-risk individuals. We provide a plain language overview of the study, as plain language as we can. We have a hover over glossary that you can toggle off if you don't like the teal shading of the words, but it links to our glossary and explains some of the jargon so that it's not too jargony. You don't have to have a medical dictionary to see what the study is about. We also include plain language inclusion and exclusion criteria. We use visual color cues, so green for eligibility, red for ineligibility, and we don't list everything. We list the things that people are most likely to know about themselves. Including the genes. So if it's a study enrolling people with specific inherited mutations, then we'll list those mutations. So again, people can see front and center and decide if this study is relevant for them and if they're interested. And this is the same clinical trial in clinicaltrials.gov. So, not quite as engaging, really a little bit harder to navigate. And here's one of our favorite studies. We've been promoting Wisdom for quite a while. This is the Wisdom study listing on the FORCE webpage. One of the things we really try and do is replace study titles and descriptions with plainer, friendlier language. We know from surveying people in the community, many people don't understand the term germline and variant and pathogenic. Germline is really basically, for the most part, an inherited mutation. Pathogenic just means it's harmful. But when we survey the community, what we've heard is many people don't know and they're not comfortable with that terminology. So this was a study. This study's no longer open, but it's a really good example. It was a study called a multivariate index assay for ovarian cancer risk assessment in women with adnexal mass and high-risk germline variants of an X. I mean, that's a mouthful and it's intimidating, but it is a study that might be of interest to people in our community. And so when we did have the study listed on our tool, we put a new risk measurement tool for those at high risk for ovarian cancer. And you can see one of the groups, because there were several different groups, including a group with an adnexal mass, which just means, masses like ovarian cysts or, things that don't belong in your ovaries. But there was a group that was open to women with a inherited mutation, but the way they wrote it is women with a predisposition in developing ovarian cancer due to a positive pathogenic variant. And again, what we heard from our community is that not everybody understands the term pathogenic variant. So we put women with an inherited gene mutation that puts them at high risk for ovarian cancer. And we try to keep things as plain language as possible while still retaining the accuracy of the information. Not always easy. So I'm going to move on from the research to our public policy work. This is an area we're really proud of. This was a quote from our community. I just want to extend my heartfelt thanks for the assistance you provided with your sample appeal letter on risk-reducing bilateral mastectomy for mutation carriers. We were successful in getting a decision overturned on appeal by an independent external review. And actually, we get a lot of quotes like that. This is the QR code to our public policy, and it includes information on some of the laws and also includes information on getting financial support and having insurance cover procedures, and it also includes our appeal letters there. And so, every year we set public policy priorities. We also work with a lot of partners and sign on to a lot of letters, but we spearhead public policy efforts that are really relevant to our community. For a very long time, we've been doing federal public policy, but in the last few years, we also started doing state-based public policy. It's somewhat easier to pass laws in states than it is to pass federal laws. But these are really the types of things that we focus on, trying to ensure affordable access to care, protecting genetic privacy, advocating for patient safety. We work with the FDA in order to do that, accelerating research and reducing health disparities. And, one of the things that so we have a page of state public policy initiatives. So these are the things, and federal public policy initiatives. These are the laws that we are trying to get passed for each state. It talks about the law that we're working on and whether it was passed or not. We also have a similar page that goes state by state and talks about the laws that have been passed that require coverage of things like cancer screenings. We just launched the page right now. I think we mostly have breast cancer screenings, but it is our intention to include ovarian, pancreatic, prostate, probably not ovarian. There isn't much in the way of ovarian cancer screening, but pancreatic and prostate cancer screening as well. I did pull out Kentucky because one of our biggest, most recent successes that we're really excited about in the state of Kentucky, they passed a law that requires private and commercial health insurers and Medicaid to cover all cancer screenings recommended by the NCCN or other guideline organizations with no cost sharing for the patient. And one of the things that makes that huge is it doesn't only cover things like breast MRI, but if you are a person who's at high risk for pancreatic cancer, for example, there are screenings for pancreatic cancer. They are recommended in the NCCN guidelines, and they can be very expensive. So we were really excited about that. We're trying to use this as a model for other states. In the meantime, most of our other successes have been with high-risk breast screenings, including breast MRIs for high-risk individuals starting at a young age, with no out-of-pocket cost, so no cost sharing. And what that means is you cannot be charged a copay by the health plan. So really exciting. We've been doing a lot of work on this, and I encourage you to go to our website to read more about the public policy efforts. And this is just a link to how to get involved. This is the state laws that I was talking about. So in California, currently, there's no state law, which means it follows the federal breast cancer screening laws. And we do have a grassroots engagement platform that allows people to go in and write to their elected representative to talk about the things that are important to them. And we have some sample letters, so you can take a look at that if you're interested. We also have a new program called our PALS program, where we train people in the community to get involved in state public policy efforts. And, one of the other things we're really proud of, and I highlighted this because this is a recent blog, is how much we work with partners and other organizations to increase access to inclusive care and resources. So this was the result of a survey that we did in partnership with Living Beyond Breast Cancer and the National LGBTQI Cancer Network on why gender matters in breast cancer care. And it really shares the results of a survey that we did on providing inclusive care, and especially for healthcare professionals and health systems, on providing inclusive care for transgender individuals. But this is just one example of the ways that we work with partners to increase access to care and more inclusive care. And with that, this is how you can connect with FORCE. And
excellent. Yeah,
sure.
Sue, you guys are doing so much in so many different areas and are such a rich resource for people. Thank you for sort of showcasing all that you do, and would love to hear if people have questions about either the programs or the services or any of the information that Sue just mentioned. There was one question about if there was any information about uterine cancer on the website, perhaps.
There is. And endometrial cancer, that's a great question. We serve the Lynch syndrome community, and P10, BRCA1 has been linked to, a very rare type of uterine cancer. We do have information, clinical trials on and prevention information on endometrial and uterine cancer.
Thank you. There was also a question, or maybe a follow-up from the asparagus article that you featured. I can't remember the outcome of that, if you debunked it or what, but the comment was, does this mean we can stop having to explain why we don't want asparagus every spring?
No. The goal of the study was not to show a link between asparagine and metastatic cancer or aggressive cancer. Really, we debunked the article. You can continue to eat asparagus or not, based on your preferences, but there's a lot of good reasons to eat vegetables. So eat your veggies.
Yeah. Other questions for Sue? Yeah, go ahead.
I was going to say, we have a lot of articles on nutrition, on supplements. These are areas that oftentimes when the media covers it, they tend to really hype what the research found. Some of the early, very exciting research, a lot of times gets really, really like, again, hyped and, when it's probably 10 years away from being clinically relevant. But we've now been doing X-ray long enough that we've gotten to update some of those exciting research findings. I remember when, the early studies came out on immunotherapies and rectal cancers. And, so we do kind of follow the progress for some of the clinical research. And really that's the point, because if people can see the through line between participating in research, the studies done, now we have the outcomes, they're early, now we have more studies, now we have these long-term outcomes, then, they're going to be more inclined to participate in research. And, having the privilege of being able to do this for 25 years, I've really had a first row seat into how much progress has been made.
Also, just to promote, you guys have a newsletter that has sort of key highlighted articles, activities, studies. Wisdom has been featured several times in those newsletters. We always get a little bump in enrollment because of that. But it's a great way to get updated on a regular basis on all of the activities at Force. So if you, the website was just put in the chat. I'd encourage you guys, if you're interested, to sign up for at least the newsletter and kind of at least on a somewhat regular basis, get updated on some of the key updates and changes and new information that Force is providing. So it's a great way to learn and keep in the loop. Yeah, other questions for Sue, or just in general questions, just as some context too, as a reminder for people. So in Wisdom, we are doing genetic testing for those who are in the personalized arm of the study. Right now, we are testing for 9 breast cancer related genes and then smaller changes in the DNA that are called single nucleotide polymorphisms, or SNPs. And we put those together into a polygenic risk score. And really, we're trying to learn and see what information we can generate from the general Wisdom community, who are not necessarily people who have a family member who have been diagnosed, trying to learn what the kind of population level metrics are around who is a mutation carrier. And we did learn, and some of our early statistics have shown that 60% of the women who we found to have a genetic mutation in Wisdom did not have a first-degree family member. And so those people would have never been offered genetic testing as part of their clinical care. So, it goes to show that there are lots of pieces to the puzzle in terms of cancer risk. And this is one important piece, that if we limit who gets tested, we may never know that someone is at risk, and we won't be able to provide the preventive options that we know can help to prevent someone from even getting a diagnosis. So just putting that into context with Wisdom and what we're trying to do, and the resources at Force are immensely helpful in helping us to provide resources to women across the country, because Wisdom is nationwide, Force is nationwide, and can connect people to resources locally and help to be that advocate as well.
Yeah. I'm happy to share just a couple of highlights from the needs assessment results. Hopefully we will turn it into a blog as well, but a couple of the things that really stood out to me as I was doing it, and I might have the numbers wrong because I don't have the slides up, but they're going to be close. 65% of our community that responded, so these are people with inherited mutations, said that they had provided caregiving for a relative. That is a huge caregiver burden. So, that's something that we're going to be focusing on. The other thing that was really noteworthy to me, I think it was something like in the 60% or 50%, it might have been more like 50% of the community that was high risk for gynecologic cancers had never been told about the symptoms of gynecologic cancers. And, gynecologic cancers do have symptoms, even though they're vague. It really is important to know what they are so that you can report it, especially if you're high risk. And so that's something we're probably going to be working on as well, based on that needs assessment.
That's wonderful. Yeah. And I appreciate you sharing your story too, Sue. I mean, I think, again, one of the goals of wisdom and trying to figure out who has high risk, who maybe has a mutation at a younger age. Your diagnosis was at 33. You wouldn't have been offered screening. You have a mutation. I think, we're hoping to find people like you
Right.
earlier and be able to intervene and to say, you are at high risk. Here are the things that you can do. For those who also don't know, Wisdom just in the last, I guess, almost year lowered the enrollment age to 30. So we're now enrolling women 30 to 74 with the goal of finding women earlier and making sure that they can pursue preventive options if they are at high risk. So
And
again,
yeah,
yeah.
I was just going to say, my mutation came from my father. We didn't have a big family. And so I had no family history. I did know my paternal grandmother had died young of what I was told was kidney cancer, that I now believe was probably ovarian cancer. But that was it. And so I became kind of that red flag cancer case in my family. And yeah, it just really kind of struck out of the blue.
There's another question about multi-cancer early detection testing. That's not something we do in Wisdom, and I think our clinicians, the last we weighed in on this sort of jury was still out in terms of the value of doing multi-cancer early detection testing. I'm not sure, Sue, if that's something you guys have in your information and materials.
We do. We've covered it. We've actually x-rayed it a few times, and we did some headline hypes, you know, related to the promotion of them because they were being promoted as earlier detection. And, I'm not, I'm a veterinarian and, I have some practical knowledge, but I'm not a statistician. I'm not really a scientist, but the data that I've seen seems to not really indicate that it's accurate or clinically useful, especially for people who are high risk. And I think there's a lot more validation that needs to happen. This is just my opinion, but there are some clinical research studies looking at the multi-cancer early detection test. So I would encourage people who are interested to do so in a study if you can, so that we can look at those outcomes and figure out if this is something useful for high risk individuals or not. Great question.
Yeah, I know here at UCSF, we actually had a session probably 6 months ago, and they've created a new initiative on how to handle these tests and, patients asking for the tests and the value and how to evaluate them as well. So, I mean, it's something from a clinical perspective that I know physicians are faced with all the time, as with any new test. People want what they see, and there's such great advertising and marketing out there from these companies, and so it's wonderful that organizations like Force are out there to kind of put it through the process and see what information truly is there, read between the headlines and figure out if something looks shiny and new, it's probably just shiny and new. We have to put it to the test and see what its value is.
At 25 years has given me a lot of perspective. I've seen a lot of, especially ovarian cancer early detection tests go on the market, come off the market because they weren't validated. I think too that there is a little bit of difference in trying to do early detection for a cancer you may be high risk for, where there are guidelines about what you really should be doing. And I do worry that people will rely on some of these tests when we know that things like salpingo-oophorectomy, removal of the ovaries and tubes, I did it at 35. Part of my talk tomorrow is a lot about that. And it has a lot of consequences. But on the other hand, we do know that people live longer if they do it. And so I worry about people thinking I can do this instead of this. I do think, I know there's been some, this isn't multi-cancer, but there's been some pancreatic cancer tests in research. I think there'll be more research on it. I think that's really important. One of the gaps that we're seeing at Force is now that so many people in our community are surviving or previving breast and gynecologic cancers, is that they're now living long enough to worry about pancreatic cancer. And currently the guidelines, there is some screening for pancreatic cancer. It is not, it's expensive and not without its own risk, just because it's pretty new, but the studies have been very encouraging. But the guidelines are really only for people who have a gene mutation that puts them at very, very high risk, or people that have a gene mutation that puts them at increased risk and they have a family history. So BRCA2 and BRCA1 really need to have a family history also. The challenge is we know family history, like you were saying before, it's not the greatest predictor of who's going to get cancer in a family. So we do need other options. And, we do recognize that. But again, if people are looking for, blood tests, we encourage you to do it in a clinical trial if you can.
Wonderful. Other questions? Other comments? And I see, Barry, that you commented about the multi-cancer early detection testing. Barry is a genetic counselor who worked with us on the Wisdom study for several years. I'd be curious, actually, I don't know if you want to speak up, what your experience has been as a genetic counselor.
We don't have any specific data, as Sue was saying, in a high-risk population about how this is used. And I also echo Sue's concern where we do have very well-established both screening and risk reduction techniques for individuals who are at high risk. And so we don't want to miss I always mess up analogies, but miss the forest for the trees, whatever that analogy is. However, at UCSF particularly, we are in the process, like you said, Allison, starting up a clinic where we're learning, because there are a lot of individuals who are curious about this, and we also don't want to kind of stifle people who are already engaging in this. And so there are some people who are already learning more about it, and we want to at least take things to the next step when we do find the results of it too.
So that's interesting. And I wonder, are you guys going to do a registry or some other way to follow people out so that we can capture that data too?
I'm not sure if we're going to be specifically studying individuals who are at high risk, but I know the individual who's leading it is Margaret Tempero, who used to lead our pancreas cancer group, and this is a special like sabbatical interest of hers. And so there's multiple arms of it that will be happening. And I think one of the initial arms are people who are walking in with the results of one of these tests already. Because that is clearly already happening.
Yeah. It seemed to me, at least some of the data, and I haven't looked in a long time, a lot of the positive results where they found cancers were really being driven by breast and colorectal cancers, which we do have detection for. And so, I mean, maybe that's changed a little and there's more data because that was several years ago. And, again, that's worrisome because there's early detection.
Great. Awesome. Let's see. I see another comment. Genetic counseling was not offered after having breast cancer in 2 female siblings and having negative testing done herself. So not sure if that means one has no concerns. I would say from a genetic standpoint, it probably depends on the type of testing that was done. But also it's one piece of the puzzle, right? So that's a good sign, but at the same time, there are other components to a cancer risk assessment that still need to be considered. So I think also we know what we know within genetics, and we're continuously learning. So, there may be something in the future where there's a different gene or a different area of the of genetics that we can evaluate and see that there's maybe something new that's come up. I don't know, Sue, if you have comments on that.
I just like to ask people when they had testing too, because testing's gotten so much better in the last decade. So if it was a while ago and there's really no result that informs, the cancer in your family, then it's probably worthwhile. Um, you know, and it's always worthwhile talking to a genetic counselor, in my opinion. They are great healthcare professionals. We love them. They're the number one referrer to force, and we're always referring people to genetic counselors. They have great training in this. So I would say, by all means, go see a genetic counselor, but also, especially if you had testing done, a decade or so ago, then there may be benefit to more testing.
And I will say, I'm not sure if this person is a Wisdom participant, but in Wisdom, we offer high risk counseling with our genetic team, our breast health specialists, to anyone who's determined to be at high risk, whether they have a mutation or something else puts them in that high risk bucket. That doesn't mean that people who are in the lower risk buckets can't also talk to a breast health specialist. So if you are in the Wisdom study, you didn't have a mutation, we told you you don't have high risk, you can still ask to talk to someone and talk through, what this means for you, especially if you have two siblings who are diagnosed, there may be other considerations. Um, Also with that polygenic risk score that we use in Wisdom, sometimes people will have a negative genetic markers in terms of the 9 pathogenic variants, but they may have a high polygenic risk score. And so that's another way that we put people in a higher risk category. It's not, the polygenic risk is not something that's offered in standard clinical care. It's something we're studying and looking at in the Wisdom study. So again, if you're a part of Wisdom, I'd encourage you to reach out and ask for a consultation. If you're not in Wisdom, I'd encourage you to join, and maybe there's some other information that we can evaluate in the polygenic risk that might be helpful to hear. So, yeah. Other questions? I know we're coming up on the hour. Any last questions? Okay. Well, we have a feedback survey that we'll put in the chat right now, but just really wanted to thank Sue for your long time dedication to this work and all of the amazing accomplishments that Force has achieved. And also thank you so much for being such an amazing partner to the Wisdom study and helping us not only to bring more women into the study, but also to provide the resources that we rely on to provide back to our participants as well. So thank you to Sue, and thank you everyone for being here today. Please
Sure.
do fill out that survey. We will post this recording to our Wisdom YouTube channel. So if you want to listen to it again or share it with someone who wasn't able to join, please feel free to do so. And it sounds like Sue's willing to share her slides too, so we can make those available to those of you who joined as well. Wonderful. All right. Well, thanks so much,
Thank you,
everyone, for
everyone.
joining. Thank you so
Have
much,
a nice
Sue.
night.
Have a great evening. Thanks so much.
Take care, everyone.
Bye.